Welcome back to the show. We have paged Dr. Paul, and once again, he's arrived with some great information today. The topic is Lyme disease and tick bites.
That's right.
All right, so I guess, you know, and just in talking, this is something that, not to look out, it's actually here.
Well, it is here. You know, 10, 15 years ago when we first started talking about it, it was in sort of pockets of northern United States, northeastern United States. And over the last couple of years, we've been seeing an increasing number of cases in Canada. Not that many. You know, we've had a couple in the Eastern Ontario area over the last couple of years. However, we are aware that what's causing it is the tick. It's a little tick. It's a deer-legged, it's called the black-legged deer tick.
Okay.
And it's very hard to sort of see with a human eye, but that carries the bacteria that causes Lyme disease.
Okay, so we're looking at this right.
That's right. And what happens is you usually get it, the tick can attach itself to you or animals, by the way. And if it is carrying the bacteria and bites you, it can inject the bacteria into your bloodstream, and you can get a range of symptoms that are mild rash, and actually the telltale sign is almost like a bullseye rash, and you can see the size of the tick right there. And it gives you a bit of a bullseye rash, and then gets into the blood and gives you flu-like symptoms and fever and so on. Good news is it can be treated by antibiotics. If it's not treated and it goes into a chronic phase, it can affect the heart, the nervous system, and the joints.
I've heard that, and I've heard that there are long-term effects to someone who might have been bitten by a...
Well, you know, very rarely people who don't get treated or don't realize they've had the disease can have chronic symptoms. And some blood tests can differentiate between the two. Again, it's a rare entity here in Canada, but it does occur. But what we've been seeing at our health unit is we've actually been testing ticks, and if people have a tick, you know, find a tick on them, we can test it. You know, they can call the public health unit and we can send it for testing. Why? We want to make sure what type of tick it is, because you can't really, the human eye can't discern which one it is. And secondly, we want to see if the bacteria is in that tick, and so it gives us an idea where it is. The other thing that people need to know is that it's avoidable. You can avoid it, and basically what you need to do is be tick aware, tick smart. And so if you're going to go out in the woods, and people who are at risk are people who can't go out in the woods, but you know, exactly.
Well, I mean, we're looking at footage right now, but it's kind of like, you're like, okay, you want the kids to be outdoors and exploring.
You do want them to be outdoors. You do want them to be outdoors. Usually we find it more in the southern area here, sort of more towards the coast of the St. Lawrence Seaway area, but we have had some cases in the Eastern Ontario area, more around, you know, this Prescott-Russell area as well. When I say cases, positive ticks, not human cases. And so what you want to do is you want to protect yourself. Obviously, you take the same precautions that you do for mosquito bites.
All right.
So basically, you have light long sleeve shirts, and tuck your pants into your socks. That's important because it can get into that as well. And basically, you can use DEET, the same spray that you use for insect repellent. And so you can go out in the woods and enjoy yourself. And the other thing you can do is when you come back home, when you're examining your kids before the shower, just look over their body and make sure they don't have any ticks in the armpit area, in the neck area, or anywhere on the skin. If they do have it, try to remove it with a tweezer, and you can. It's not that difficult to do.
Do they stay?
They can stay.
I mean, we saw footage and they were looking through.
Yeah, they would walk around. Yeah, they could walk around, but they usually stick onto the skin and bite. And so what happens is they usually stuck there. You pull it out. Yeah, sometimes they could bite.
So you're pulling it out, and then what stays?
It doesn't stay. Usually doesn't stay. Just if it does stay, go get medical help because they will just remove it. In most situations, the tick doesn't bite. It's just an insect walking around. You pull it out, put it in a little container, and bring it to your local health unit, and then we can get it tested. But the bottom line is just be tick aware. And it doesn't mean, the other thing too is, it doesn't mean that the tick that's on you is the tick that carries it, that deer tick. Animals, we have some dog ticks and so on. And that brings me to the point about animals as well. We have been seeing some cases of animals getting infected, having Lyme disease. And if your animal does have a disease or is sick, you know, bring it to the vet. And in many situations, just because it's a tick, it doesn't mean it's Lyme disease, and it doesn't even mean it's the same tick that causes Lyme disease. We just want people to be aware. It doesn't mean you shouldn't be going out. Just be tick aware.
Okay. Great information, and there's more information, of course, on your website.
Yes, on our website.
And you can check out drpaul.com. There's also a ton of information, too, with the Eastern Ontario Health Unit. Always a pleasure.